Hello, everyone, and welcome to McGill Cares webcast series supporting family and informal caregivers. I'm Claire Webster, a former caregiver, certified dementia care consultant, and founder of McGill University's Dementia Education Program. I work with a dynamic team of leading healthcare professionals to oversee the program, who include José Moret from the Division of Geriatric Medicine and Dr. Serge Gauthier, Professor Emeritus, formerly of the McGill University Research Center for Studies in Aging. McGill Cares is supported by the Amelia Saputo Community Outreach for Dementia Care. We are having a very special webcast today. The topic is Lessons from a Double Duty Caregiver. My guest is Zelda Freitas. She's a graduate of the McGill University School of Social Work with 30 years of experience in the delivery of services to older adults, their caregivers, and their families. She is currently the clinical advisor, professional practice at the CIUSSS West-Central Montreal. Previously, Ms. Freitas was the coordinator of developing practices in support of caregivers at the Center for Research and Expertise in Social Gerontology of the CIUSSS West-Central Montreal, and a clinical supervisor for the Elder Mistreatment Helpline. Most importantly, Zelda is also a caregiver to her mother and father, who both require around-the-clock monitoring and care. She will talk about dual role as an unpaid caregiver to her parents and as a professional social worker. Welcome to McGill Cares.
Thank you, Claire. Welcome. I'm glad to be here.
So you wrote an incredible essay for the 2022 World Alzheimer's Report, which is called Life After Diagnosis, Navigating Treatment, Care, and Support. A very powerful essay in chapter 16 for those people that would like to go and refer to the World Report. And you talk about your journey as a daughter and a social worker and really navigating the care of your parents. So can you tell us like your story and how did this all begin?
Sure. Well, the story of caregiving for my parents began about 9 years ago when my dad was diagnosed with vascular dementia. And my mother actually was his main caregiver for many years until she started to need care herself about 3 or 4 years ago, where she started to decline. She has multiple health problems, and I believe that the caregiving stress also added to her advancement in her illnesses. And so she also started to develop some signs of cognitive impairment due to other reasons, more related to her diabetes and so on. And so we had to take on more and more of a role, an active role in caregiving once my mom needed that extra support. So this is how our caregiving journey started. There's 4 of us. I have 2 sisters and a brother, and we all rallied together to develop what we call a care team to take over and to supplement some of the care that they started to develop in terms of their needs. So we're actively caregiving for both of them. They require, as I said, 24-hour care for different reasons. Dad, because he has advanced dementia now, and really worried about him getting up in the middle of the night, so he needs some supervision during the evening and at night. And mom, because she also gets up spontaneously in the middle of the night to go use the washroom, and she's not able to get up on her own, so she needs supervision overnight for those reasons as well. So yeah, it's been quite a journey. We're doing more and more as their needs increase, and trying to find some kind of balance in all that.
How old are your parents?
My mother is 92 and my dad is 89.
Mm-hmm. So your dad was diagnosed with vascular dementia. So can you talk a bit about like vascular dementia? Because I don't think there's enough people that understand the correlation between cardiovascular health and dementia. So did he suffer a stroke or a heart attack? Like what happened?
Not that we're aware of. Not that we're aware of. He might have had a stroke, but it was not something that was enough that required medical attention. It might have been silent stroke. We're not quite sure, but that was the diagnosis that we got. Yeah.
And what were some of the early symptoms that you were seeing in him?
Yeah, so he started to, forget things, misplace things, say things that didn't, that he, that happened, but didn't happen. He got lost once, and so we started to get concerned. It was mostly his short-term memory at first, and then he was evaluated, and then that's when we were told that he had vascular dementia. Yeah.
Okay. And and with regards to your mother, what were her signs?
Um, she was always, the head of, there's the, he had the problems with his dementia. So it's more the brain. My mother is more the physical health problems, but then she started to develop her dementia is a little bit different in that she is very with it and alert in certain moments, and then very unclear in other moments. So she'll say, in one hand, she'll say something that's very clear, coherent, and then 5 minutes later, she'll say, when am I going home? So hers is more, actually more difficult to deal with in some ways because it came on very suddenly. She was the main caregiver of my dad, and we started to see that she was no longer able to perform those tasks, and them staying alone became increasingly difficult because she was not able to call out for help if she needed to, call out on her lifeline, which is the emergency care button that we had for her. So we had to increase our participation in caregiving at that point. Yeah.
So you spent almost 30 years of your career in the caregiving space, and really, overseeing, home care support and everything for caregivers. So how did your professional skills help or not in your own personal life?
Yeah. Well, I think my professionally, because I was involved in the system for so long and I know what resources are available, we learn the skills of navigating the system. We do that a lot, organization and coordination of care as social workers in the community. So I think those skills really helped me pull things together fairly quickly, inform my family of what's available, what we have to be putting in place, pacing out the resources, helping them understand how the system works. I think the knowledge and the skills developed in the healthcare system really helped, I think, move us along quickly into a space where we, were able to put supports in place, and benefit from that, from having the information and the knowledge. I think where it may have not helped me is because I'm very aware of, some of the gaps in our system, some of the weaknesses, as well as the strengths. And I think knowing a little bit about how dementia evolves, the impact that it has on families, the impact that it has on caregivers, that knowledge helped me plan with my family, but it also was devastating in some ways.
So what are those gaps in the system?
Well, we've here, in the news, we know that there certainly could be more support available through our home care programs. There could be more information to the general public about our CLSCs and what home care could provide. I think there's a lack of knowledge and information, so people don't know where to turn. And I think having that knowledge firsthand really helped my family get also gain from that knowledge fairly quickly. But there's definitely a gap in accessing services as well for people, knowing where to turn, knowing where to get help. I think that's a real gap.
Yeah, and that's what I had experienced, and we continue to see, having worked on the World Report, I think that gap, it's not only, a problem provincially or nationally, it's a global problem. I mean, we know that on a global level, when it comes to dementia, for example, the majority of people have no idea about the signs and symptoms, how to take care of the person that is being diagnosed. And then the second big issue is how to access support from the local healthcare system, like the role of the public healthcare system, or even what private resources are available.
And
right?
community resources, right?
And
Like
community resources.
knowing how to access. I know, for instance, when we first found out that my dad had dementia, we have to adjust our communication with him. We had to, learn more about dementia and how to communicate and how to understand the illness. And turning to community organizations such as the Alzheimer's Society of Montreal, Alzheimer's Group, and their workshops and their support that they have available for families was extremely helpful for my siblings, who benefited from joining some workshops and understanding a little bit more about how to communicate with dad now that he had some limitations in that, and not learn how to not get frustrated and understand that him repeating things was not done on purpose, and all of those things that we know we have to adjust to. I think having that support from the community as well was really important. But definitely the home care team is essential in helping to access services, and having that access is extremely important for families. And I think we need to do a little bit more of that, is getting them the access that they need to the services that exist.
So you said that you were quite a few siblings. When I work with families, one of the issues that arises all the time is that this dementia in itself causes a lot of stress among family members, because not everybody is at times on the same page. Not everybody understands the illness. There's a lot of denial. Oftentimes siblings feel that one of them is doing much more than the other. So how did you as a family come together and navigate the care of your parents?
It was at times a struggle, for sure. I mean, there's no question that it puts a lot of stress on relationships. We had to learn to work together. I think a lot of that came from the foundation that my parents gave us. Was to be very close as a family, to communicate, and to be able to really focus on the needs of our parents. And if we stayed focused on what they needed from us, and working on making sure that they had a quality of life, I think it helped us to remain focused and together as a unit. I'm not going to say it's been perfect. We've definitely had our challenges along the way. We all have different values and beliefs, and even though we're all part of the same family, we do have different needs, different life experiences, different family experiences that we have in our own personal lives. So we're all at different points in our lives as well. And so I think honest communication. I think one thing that's really helped us a lot is, and I encourage families to do it, is have family meetings on a regular basis. We came together on a regular basis with points that we needed to discuss. We came to decisions together. We reviewed how we were feeling, kind of coming together a little bit as a family as well. Understanding each other's limits is another thing that's really important. But I think family meetings, being transparent, keeping on track. We have a WhatsApp group of chat that we use all the time to keep each other informed, ask each other questions. So I think that's helped a lot as well. And I would encourage families to use those tools that are available to come together if they can. Certainly it is a challenge at certain times. There's no question.
So you have a lot of experience with elder care, and how can you describe the caregiving journey for people looking after parents or spouses who have dementia versus just general aging and frailty? Like what would you say is the biggest difference?
I think the biggest difference is that you're in a position where you're taking on a more active role in the lives of your parents, and you're also more involved in their lives than perhaps you might be if they were just aging in place, so the relationships change, and I think that makes a huge impact on not only the person that's providing the care, so the families and the caregivers, but also on the person that's aging. The uncertainty of things as well is something that you try to plan for, but you can't always. And so I think you have to pace yourself. I think as you move in, sometimes it's a gradual shift into a caregiving situation, but you can't forget that you're also a daughter or a son, and those relationships need to be nurtured and maintained as well. And so it's quite a juggle, it's quite a balance, and you're always trying to find some kind of equilibrium in all that as the situations evolve. And I think that's a bit of a change than having parents that are aging in place and aging healthy, as opposed to aging with illness. And we know dementia is a gradual decline in autonomy. Sometimes it's quickly, sometimes it's gradual. If it's gradual, you have time to adjust. If it's quick, if it's a quick change in the person, that causes a little bit more, I would say, stress. But I also think that it's also difficult to watch the decline. It's emotional. You're watching someone that you're emotionally attached to lose a certain amount of their person as they're shifting in their illness, and I think that's difficult for caregivers to witness, is witnessing that decline.
That constant decline, and it's like it's that constant anticipatory grief, right? You're grieving
right.
constantly for a person who's still living, and you're grieving over such a long period of time. I remember myself, and when working with other caregivers, even at the beginning when they start losing that ability to communicate and share those conversations, and when my children were young and I wanted to tell my mom about their accomplishments and the soccer or the school or and it was like talking to a person that was completely blank. They couldn't engage, and I find that was mourning. And then as you mentioned, as time goes on, when you're just constantly witnessing the physical changes that happen, it's a very long mourning period. So with regard for yourself, like what has been hardest for you? Like, is it all of that? Have you been able to also find that balance between your professional life and your family life? Like, how has it impacted you?
I have been, I've been very lucky to work in an environment that respects caregivers, and so there's a certain amount of flexibility that I've been privileged to have. So I think that's helped a lot. I think workplaces need to acknowledge caregivers a little bit more, and respect the need for flexibility as much as it's possible in their workplace, and also support from colleagues. I think I've benefited from as well. So I think that's been very helpful in that end. I think one of the most difficult things has been trying to maintain balance. We have multiple roles in our lives. We have work life, we have our own family life, our relationships, our partners, our children, if we have friends, social. And I do find that over the years, I've had to make some difficult choices. I want to do a lot of things. I like to be involved in a lot of different opportunities for growth, and I feel that I've had to limit that, and that's a loss as well, right? So we have to make some difficult choices as caregivers. Even going on a week away on vacation, it's like, can we go? How you're away, but you feel like the days that you're supposed to be caregiving is now someone else is doing it for you. So that's a challenge as well. So it's trying to find some kind of balance and all that. And I have to say, sometimes it's tipping one way or the other. It's you're always trying to it's never perfect, right? So you feel like you're cheating someone somewhere, if it's not your family life, or the errands that you're supposed to run that you're not getting to because something happened and you have to be there instead, or an afternoon meeting that you might need to reschedule because you need to go to your caregiving duty a little bit earlier than you thought, or trying to shift things around at the last minute. There's a lot of reorganization and organization that It takes a toll sometimes. It's an added stress to kind of try to keep that all together. But I think because we're doing it all together as a family, and we're able to rely on each other, it kind of it does definitely help. I think if someone was doing it all on their own, I can imagine I have a new appreciation for caregivers that are caring on their own.
Mhm.
And I think that I'm taking a lot of those lessons that I'm learning as a caregiver and bringing it into my professional practice.
Well, I was that caregiver all on my own,
Yeah.
and it was really difficult, especially when it came to making some of those end of life decisions. Are you making the right decision? And like you say, I think the majority of caregivers are women. We put a lot of pressure on ourselves to be the best mothers, the best wives, the best friends, the best community, involved in the community. And, as you were saying earlier, when I ended up suffering a burnout, as many people know, and I had to triage my life. I mean, on the road to healing, I really had to take a look in my life and say what's working and what's not working, right? And it meant really doing a triage of even the people in my life that weren't healthy to me, or too many commitments, and learning to say no, and only really surrounding myself with the people and projects that were adding some meaning. And my mom passed in 2016, and I still live by that. Every single time I get an email to be involved in a committee, to go to dinner, to go to a lunch, I always ask myself, is this going to add value to my life, or is it not going to? Are these the type of conversations and people that I want to spend time with, or do I not want to spend time with, right? Or how is this extra committee that I'm going to be involved in? Is it just going to add more layers to my already busy life? But I think a lot of people are afraid to say no, or afraid to let go, or and to the detriment of their own health. So I think people, when I work with caregivers today, if you don't take care of yourself, how are you going to take care of the people that need you, right?
Right.
So
Yeah.
but it's hard. It's hard to say no. It's really hard to say no.
It is hard to say no because a lot of what we do brings value to our life, right? We do things because, or we're able to share our experience with others, and that's an important. It's something that I value, and so it is hard to say no. But you're right, Claire. I think I learned from you actually. If I remember when I listened to your talk about that, and I thought, yes, when I think about people that may be asking me to do something, I think about that. I think, is this going to bring value? Is there something? Can I contribute something? And is this important for me to be doing right now? And I've had to learn how to say no. It's not easy for me to say no because I like to be involved and I'm a giver, so I'm a carer, both professionally
Yeah.
and personally. So it's a difficult thing to do, but I think we have to. We have to be able to keep in mind what's important. And what's important right now is making sure that, for me, one of the things that is important is making sure that my family is well, that they know that they're loved, and that they have a good quality of life as much
Yeah.
as possible. And so
Yeah.
I want to contribute to that. And I think living with that loss, like you said, that constant loss, that starts way at the beginning when the person is diagnosed, and continues on, and you have to adjust yourself to all of those losses as you go. And I think that part of caregiving is not acknowledged enough, is the ambiguous loss that you're living with, and I think we need to do a little bit better. So I'm committed in my professional life to help professionals, healthcare providers, be a little bit more conscientious and a little more aware of this constant living with loss. To me, that's really important piece of caregiving that's not always addressed.
And I also think, when after my mom died, a lot of people were coming to me and saying, oh, now you're better off and she's at peace. But I don't think people there's nobody also from the healthcare system to offer that post-traumatic, grief support, right? I mean, especially when you're like I've witnessed the death of both of my parents, and which is quite traumatic. My role as a caregiver was, more than 10 years. And, so you develop certain habits and coping mechanisms that don't necessarily disappear just because the person dies, right?
That's right.
And so I've spent the last few years since my mother's death is like relearning how to undo some of those coping mechanisms, or learn how to breathe, or learn how to not jump every time my phone rings or I get a text, or learning to not use wine as as the calming me down, right? So it's been a real journey that I think you don't just get over things so quickly, right? Like you've been so used to being programmed to being a caregiver for so many years. The role and the way you are doesn't just change the moment the person passes away.
That's right. You have to sort of unlearn some of those things that you've had to learn or adapt to, and deal with that a lot on your own, because you're right that there's the healthcare system is not there for you once the person that you were caring for passes away, that person dies. It's not that they're not there for you, but it's not part of what they're able to continue to offer in terms of support to the caregiver. And so caregivers are left on their own to deal with all of this unraveling, all the grief, all the unlearning, and all the changing of coping, like you were mentioning. So I think there's a lot of work to be done with that. And I think, well, we're actually working right now on a project with the School of Social Work on caregiving grief, and how do we better support caregivers once the caregiving ends, because the caregiver is still part of who they are. That's part of their identity now, and so that's a loss. That's a huge loss of identity for someone who was caregiving for a long time, 10 years, 8 years. And so how do we better support individuals to regain and find some rebalance their lives without the role of caregiving?
So I have one last question. Let's talk about the importance of getting an assessment from the doctor in order to access services from the CLSC. Because a lot of people say, well, why bother getting an assessment or seeing the doctor if there's no cure for dementia? Like, why bother, right? But so can you just talk, briefly about the importance of having that assessment in order to be able to access the services?
Absolutely. I think family doctors can provide assessment. They can also refer you to specialized clinics like the geriatric clinics, for instance, or geriatrician for the specialized assessment, memory clinic as well, to get a more specific diagnosis, so that to be informed is to be empowered. Right. And if we have a diagnosis, it is painful, yes, to have that diagnosis, but it's also empowering, because now you can do something about that. You can learn about it. You can learn what it means to have that diagnosis, not only for the person that's living with it, but also for those around them. So for the family and for the caregivers. So what are we going to do now? How are we going to manage? And I think part of that diagnosis is also being involved with services and home care or other community organizations that could help manage and problem solve and deal with crisis along the way, and access care. And so a CLSC referral is essential when someone has a diagnosis of dementia, because it'll help the family organize their home, for instance, adapt their home. So an assessment, a medical assessment is important for the diagnosis, but then a good home care assessment is important for the maintenance of the person in their own environment. So what kinds of equipment or what kinds of security measures need to be put in place for that person to be maintained at home? What kind of support is available? What resources, what respite? And there's a lot of different possibilities. There are good services out there, but it's just a matter of linking with those services. And the CLSC home care is key in all of that, because that's their purpose, is right. It's to help people to maintain themselves and help families maintain people at home for as long as they they want or that they can. And so that referral is essential. People can call the CLSC on their own. They could call 811 Info Social. So everybody knows Info Santé 811, but there's a part of Info Santé that's called Info Social. And so when you call 811, it'll guide you through the phone system. And then you can talk to a psychosocial professional, and they will help you link to the resources that you might need, or link to the CLSC if that's what you need as well. So it's really important for people to realize that there is help out there. Accessing care earlier on, informing yourselves of what's available. You may not need it right now, but you may need it in the future. So being prepared as much as possible for the uncertainty of how the illness will progress is an empowering thing, and helps families to feel more in control of the future, even though it might be quite uncertain.
Such valuable information. Honestly, thank you so much for being here with me, sharing your own personal story, and for this really valuable information. On our website at mcgill.ca/dementia, we will have a link also to the World Report, the 2022 World Report, where Zelda has written an essay. We also have the 2021 report on the journey through a diagnosis of dementia. And we also have a section called Trusted Resources, where we will have a link to Info Santé, so that if people want to have additional information, that they can go there. Thank you so much for being with us today.
Thank you for having me, Claire. Always a pleasure.
So this webcast is an initiative of the McGill Dementia Education Program, which is funded by private donations. If you would like to make a contribution to our program, or for more information, including signing up for our newsletter, to learn more about our programs and services, please visit us at mcgill.ca/dementia. Thank you for watching.